If you're wanting to work on the peroneal nerve distribution, there's some common spots that the nerve, we'll just say, can get hung up at in certain areas of tissue as the nerve kind of travels down your leg into your foot. So in this position, some easy spots to get to would be your lateral hamstring. So if you kind of feel for where the hamstring tendon is right on the outside of your knee, and then come in just a smidge inside of that. If you search around and right inside that tendon, maybe a little bit high, a little bit low, if you find a really tender spot, especially if it kind of reproduces some of the symptoms you've been feeling in your leg, that's a good spot to massage. So you can do it with your leg in this position, just digging in with the tips of your fingers and massaging and spending a minute or two here. Another spot is around the fibular head. So the fibula is a small bone that runs up the side of your leg here. And right in the corner, you can feel like a bony nodule. So the nerve can kind of get hung up around the back side of it there. So if you kind of find this bony nodule in the corner, you can kind of dig around in some of the tissue right behind it, right along in front of it. Again, you're kind of looking for hyper tender spots, maybe that feel different if you compare it to your other leg. And same thing, giving it some love, spending maybe a minute or two on that spot. The nerve runs all the way down the side of the leg here, across the top of the foot and into your fourth and fifth toes. So another really common spot is the muscle group along the side of the leg here. So again, if you kind of trace the nerve all in through here, again, you're looking for some hyper tender spots, especially if you compare to your other side, digging in and giving some massage all the way down the leg. A really common spot that you'll find is actually on the top of the foot, right along where all the extensor tendons for your toes are at. So right along the top of the foot, there's like a meaty section in here. And if you're pushing around up in this area and it feels really tender, sometimes it can even produce symptoms into your foot or up your leg a little bit. You're gonna spend some time working on that area as well, digging in, massaging it, and then working all the way down to those fourth and fifth toes. A lot of the times after you've spent time massaging each of these areas, I'll even just do some deep pressure that swipes through the entire area and ending with a stretch of the foot where you're kind of turning your foot up and in, stretching all the way down to those fourth and fifth toes, and doing that a few times. So realistically, if you do this whole process, especially if this is something that's been nagging for a little while, you might have to spend a good 4 or 5 minutes on this, just kind of massaging each tender spot and then working through doing some deep pressure all along the nerve track and stretching out the foot, again, kind of pointing it up and in. There's a few different ways to work on this, but this is just one, so go ahead and give it a try.